GAAMHA opened the Pathway House in 1972, and Pathway House, since that time, has provided residential recovery services to adult men 21 and older with substance use disorders. In addition to Pathway House, we offer the Pathway Supportive Housing Program, where we have 2 houses people can live in supportive housing with supportive case management, and it's meant as a next step in the continuum of care. When someone enrolls at the Pathway House, the first thing we do is ask people what do they want to accomplish when they're there. Because we don't want to take anyone in that we don't believe we can help be successful. We assign a counselor who will be with that person through their entire journey, through that 6 months. And we set up that treatment plan surrounding how do we help them achieve the goals that they've self-identified. Now, clearly one of those primary goals has to be, sustained and hopefully contented sobriety, which can come in many forms. We're not talking about just abstinence. It could be medication assisted. It could be any venue to sobriety that leads to a successful life. We don't just teach sort of recovery theory. It's practical experience where people get to live recovery day in and day out and make the mistakes of early recovery with the support in place so that it doesn't end up in a return to use or a relapse situation. We'll help them find employment if they've identified that as a goal. If they're not going to work, we want them doing something community-oriented, volunteerism, community service, something of value throughout their day that connects them to their community. We know that when people have and use social connections, their outcomes increase tremendously. We try to be very comprehensive. That's the great thing about a 6-month program is you have the opportunity to take a real big picture look at somebody's life and help them set on a course for long-term success.